Hello everybody, it's Dr. Alex Earl, and we're here at Pure Plastic Surgery, and it's Hump Day with Dr. Alex Earl. And we're back. I know last week we were off. I was on a little spring break vacation with the family, but we're back here this week. And so it's time for me to be able to answer all your questions and of course go over some important plastic surgery topics, okay? So today I thought we'd go over the different BBL types, okay? The reason I thought it was a good idea because we recently had an article come out on AE Edit. AE Edit, you can look that up on Instagram as well, where I discussed the skinny BBL. It's a great article, and so after that article came out, which got a lot of views, a lot of people reading it, we started to get a lot of questions as to what exactly is a skinny BBL and how is that different from your regular BBL. Okay, so that prompted me to then think about, well, let me just explain some different BBL types, and then kind of try to explain some of the similarities, some of the differences there, so that then everyone's on the same page. Okay, so of course you have, we're going to start off with your standard BBL. And as obviously many of you know, BBL starts for Brazilian butt lift, and I gave a talk maybe about a month ago or more now regarding a little bit about the history of the BBL. And the reason it's called a Brazilian butt lift is because it was first done by a very, very famous Brazilian plastic surgeon called Dr. Ivo Pitangui. So he was the first one to do it. He's from Brazil, and so that way the name came out, Brazilian butt lift. It is a little bit of a misnomer in the sense that it's not truly a butt lift, okay? Like in the sense that a breast lift is like a breast lift, or an arm lift is an arm lift, meaning that we're not actually removing skin and we're not like physically doing something to lift up the buttock. There are actual surgical butt lifts where you have a big scar that kind of comes across the back like that, and so this is not a surgical butt lift. So it's a little bit of a misnomer there, but now that's the way it's known, and so everybody knows it as the Brazilian butt lift. Okay, so what is the BBL? Of course, for most patients, the standard BBL involves the liposuction, so it's liposuction 360, which means liposuction of the entire torso. So that means your abdomen, your flanks or the sides here, and then your back. Pretty much most of the back we include in our Lipo 360 liposuction that goes just to above the level of the bra line all the way down. The only additional area to the back would be what we call the buffalo hump, which is up here. Most people do not need that. There are a few people that do, and if we include that, then that is considered an additional area. Okay. Then what are some other additional areas you can add? You can add, of course, the arms, the chin, the thighs to that. And then we take that fat, we remove all the excess fluid, we do kind of treat the fat, we place antibiotics to the fat, and then we transfer the fat into the buttock and that's called fat transfer or fat grafting for your Brazilian butt lift. And with this, we can really alter the shape of a patient in a very, very powerful way. So that's your traditional BBL. Typically, this was done for patients that were a little bit higher on the BMI scale. So we're talking about BMIs probably about 25 or higher, and then up to whatever limit for that particular surgeon. So my limit is a BMI of 30. Dr. Vidal's limit is up to 33.5. There are some surgeons that go higher than that, though I probably wouldn't recommend it. So in my particular case, it's going to be probably a BMI from 25 to about 30, okay? And then in terms of how you shape it, a lot of it has to do with the patient's preference, okay? But yeah, you can go anywhere from, say, more of a natural look to the more kind of dramatic looks, more like the soft vixen type of looks. Sometimes you can get even into vixen looks, but typically for that, you may need more than one round. So you may need 2 rounds of your regular standard BBL to get those really big vixen looks, okay? Back in the day, when we were putting muscle, when plastic surgeons were putting muscle into or deep to the muscle, you could get a vixen look in 1 round. But of course, now we know that's really not safe. It is not a good idea to do that. You can injure those big vessels. You can get a fat embolism. The patient can die. And so we don't do that anymore. Now we place the fat between the muscle and the skin. That is a safe space. In order here at Pure, in order to make sure that we are in the safe space, we use ultrasound guided imagery to know exactly where the cannula is. Okay, so that's how we make sure we're in the safe space. And so these super dramatic looks, you typically can't do that with one round anymore. On the other side, though, they're actually not as popular now as they used to be, because people see that, as they get older, 10, 15 years down the line, now we're having a lot of patients come back actually wanting reductions. So we're seeing more and more hip and buttock reductions now as people are coming back and they're not so much into those dramatic looks anymore. Okay? So that's your standard BBL. When you did a standard BBL, a lot of the differences here have to do with where you place your incisions for the liposuction. So typically for your standard BBL, you put one down in the suprapubic area in the middle, and the other two are kind of further apart out here, and then one inside the belly button. And if you had someone that was either a long torso or wider or had prominent ribs, sometimes you would put some up here as well. So potentially 1, 2, 3, 4, 5, 6, up to 6 incisions there in the front. And then in the back, we typically put one here, one up here and here, one in the lower back, one in the mid back, and then of course you have the ones that you put down into here too for the actual fat transfer. So potentially 1, 2, 3, 4, 5, 6, 7 incisions in the back. A lot of incisions. Okay? So now what is then the skinny BBL? So skinny BBL is then, the general concept or the general principle is similar, right? You're doing liposuction, you're doing lipo 360, and you're doing fat transfer to the buttock and hips, but this is done in the patient that's typically a lower BMI patient. So probably the lowest we would go is about 20, depending on the patient, 20, 21, up to about 25, okay? So we're removing less fat, we're transferring less fat, and the goal is typically what we call an enhanced natural type of look. So that's really the goal for the skinny BBL. So it's a lower BMI patient. Typically they have less fat to offer, so there's less fat being transferred, which is okay, because the goal, what they want is more of an enhanced natural look as opposed to a more dramatic or vixen type look. And typically, because these are smaller patients, a lot of times you can eliminate those 2 incisions up there in the front, and then eliminate this one here in the bottom. And so the skinny BBL has 1, 2, 3 less incisions total than what your traditional BBL used to have. Okay? On top of the skinny BBL, now we have someone that's on the lower BMI who's also athletic and has good quality skin, and that's the key right there, and has good quality skin. Then you can do what we call the HD or high def BBL or high def lipo with the BBL, okay? And this is where we're doing the ab etching, where we're defining the musculature, typically with the abdominal muscles, and so we're just creating greater definition there. This only works if you have good quality skin, so you can't do it on people who have a lot of stretch marks, have a lot of loose skin. You usually doesn't work on people with massive weight loss or multiple pregnancies, unless they've had a tummy tuck first. Sometimes you have a tummy tuck, then you can come back and do the HD BBL because now the skin is tight. And it's one of the reasons, there's many reasons, but it's one of the reasons that you usually almost always recommend that you do your tummy tuck first or your mommy makeover first and then come back for your BBL, okay? So that's the HD BBL, and now the other ways, the other important factor in the HD BBL is that it definitely needs to be maintained, okay? This is very, very important. You have to maintain a good diet, healthy diet, a good exercise program afterwards, because in order to create that etching, we have to remove quite a bit of fat in certain areas, leave a little bit of fat in other areas to create those shadows that create the definition, the muscular kind of etching and definition. And if you then just kind of go just all out afterwards and forget about exercise and eating, and all this stuff starts to grow, it's going to look very, very odd. And then you're definitely going to come back and you want to try to smooth things out. So there's a lot more commitment with the HDBBL. HDBBL means you have to be committed to exercise and diet program afterwards, okay? Very, very important. Now, what is the difference with the incisions? The incision numbers was about the same, but now these, instead of being all the way out there kind of wide, you typically have the one in the middle, and then the other two are very, very close together, and they're all just beneath the pubic hairline, so very, very easy to hide, you know, like in a swimsuit or a bikini there. And then you have the one that's kind of tucked into the belly button. So really, if you're even a small swimsuit, they really can't be seen from the front. But for the back, you still have these, which are a little bit tougher to hide, and you have the one mid-back in the bra line area that if you are wearing a bra, sometimes you can hide that one there, okay? And that's your HD BBL. Now, here at Pure, we decided to take things even a step further, because typically if you're looking into a skinny or an HD BBL and you're going for enhanced natural looks, nothing that's dramatic, a lot of the times you don't want people to know, or at least doubt whether you had anything done, right? A lot of these patients want people to be like, well, did she not? I don't know. Did she just have a great summer workout, great diet program? Like, what happened here, right? And so if you don't want people to know, then you want less incisions, and you want these incisions to be hidden, right? So we've developed here at Pure what we call the SO BBL, which stands for the South Beach butt lift, right? So we're not in Brazil anymore. We're in South Beach now, okay? And so in South Beach, you want to have these incisions very well hidden, even if you're like in a tiny bikini out on the beach there. So what we've done in order to do that is that we've then eliminated these two incisions here, which were the ones that were tougher to hide, especially in small swimsuits. And so now, even if you have like a little small kind of thong bikini there, that's going to be hidden. You put the upper part of the swimsuit right along that other incision, that's going to be hidden there as well. And like we said here, this is going to be easy to hide here. That one's tucked into the belly button. So that's the SO BBL. So it's essentially a combination of the skinny BBL with less incisions. And and that's the South Beach butt lift. People are being more and more conscious of where we place these incisions. They want to make sure they're not seen. They want to make sure they're not hidden. So we developed that here. Okay. And then just a few months later, for the right candidate, we did the SO BBL upgrade, or the South Beach butt lift upgrade, where we're really hiding these incisions and making them so that even if you wanted to go topless on the beach now, nobody would know. Okay, and I'm not promoting that. I'm not saying, hey, everyone just go topless. But if you wanted to, now this incision here is gone, and what we're doing is that we're placing them tucked into this area right here and right here, basically just in the armpit area there. And from there, we can address the entire back. Then we still have this one here, which is going to be very well hidden there. So those are all extremely easy to hide. Pretty much the entire back is left without a scar. So even if you went topless, nobody would know. Nobody would know, okay? Of course, for all of these, remember, we do have the two little ones down here, which we have to place for the fat transfer, okay? So this is a SO BBL upgrade. Now, the downside, I guess, to the SO BBL upgrade is that not everyone qualifies, right? You can't be someone that's too broad. Your frame can't be too broad, because we have to be able to reach all these areas through these incisions, right? So if your torso is too long or too broad, then we can't reach those areas, and sometimes we have to put that one at the bra line there, okay? But for those patients that do qualify, then we certainly try to do that so that they can really keep people guessing, right? Okay, so I hope that's clarified kind of all the different types, or at least the different names that people are calling things. But if you have any questions on any of this, I'll be happy to answer.
So to qualify for BBL with you, it starts at 30 and then under.
Yes.
So what about patients who are active in the gym a lot and they have low body fat percentage but a lot of muscle weight?
Yeah, so that's a great question. So this is a very kind of generalized way that we do, that we use, and I understand that it is generalized because it typically doesn't apply to people that have higher muscle mass, and it doesn't apply to people who are, a lot of times, to people who are going like in their round 2s or round 3s, okay? But we do have to set a limit somewhere. Actually, 30 above a BMI of 30 is what the AMA or the American Medical Association considers obese. And so typically that's the cutoff that we've made there. Now, can there be certain special cases that we can kind of look into on a case-by-case basis? It's a possibility, but you're certainly going to need an evaluation for that. You're going to need, of course, to send in your photos, all your information, and they're able to potentially take that into consideration. But even someone with a higher muscle mass, you typically, especially for something like a skinny BBL, BMI of 30 is going to be too high. Like I said, this BMI is typically in the 20 to 25 range for that there.
Do you have a BBL technique that's specific for round 2 patients? Do you use the same incisions, or is it?
So, yeah, for a round 2 patient, especially if they're coming back to me, then most certainly I can use the same incisions. But every surgeon is a little bit different. And so if they had their round 1 with someone else, and then they're coming to me for their round 2, I try my best to use some of the old incisions so as not to create new scars, but that's not always possible. So we all have different techniques, different ways of harvesting the fat, different ways of shaping the body. And I'm not going to sacrifice shape for a small little stab incision, okay? So I'm gonna do what I think is the best, the best access, or use the best access that I need to create that shape that both the patient and I are looking for.
Thank you. So after the BBL, when does the fluff stage happen, and how long does it last?
Yeah, so that's a great question. So does everyone believe in the fluff stage? Not everyone does. I personally do, because I think there is basically a curve when we're talking about the volume and the shape of the buttock after BBL. So at the very beginning, if this is a graph, right? This is time, and this is say 6 months here, and this is your surgery. You're going to start off with a lot of volume because you have all the swelling and all the fat. And then I can tell my patients we're always going to lose about 30% of the fat, and you're going to lose your swelling. So you're going to start to lose volume in the buttock and hips. And the low point is usually around 6 weeks. So you get it 6 weeks, and then your fluff phase starts around 3 to 4 months, and then comes out to here. So about 3 to 4 months is when you start with the fluff. Okay, so you start high, you go low, then you come back up. Now, when you come back up, it's typically not as high as where you started, but certainly higher than the low point there. How do you kind of plan for the fluff phase, or make sure you get that step? I think a lot of it has to do with, of course, being very compliant with your post-op care and your diet, feeding the fat, okay? You want to make sure you have a diet high in healthy fats, such as avocado, eggs, salmon, certain nuts such as macadamia, and then milk products always help, cheese, and if you need a little boost of milkshake and ice cream is always good.
Mm-hmm.
But what you want to do is, at the very least, maintain your weight that you had pre-op, or perhaps gain even up to 5 pounds, okay, in those first 3 to 4 months. You don't want to go crazy. I'm not saying gain 20, 30 plus pounds. I'm not saying that, okay? But you want to either maintain or plus 5, between 0 and plus 5 pounds from where you started. That's where you want to be to feed the fat so that you can then get into this fluff phase. If you lose weight, especially the first 6 weeks to 3 months, you won't get into a fluff phase. You're gonna do this, and then you're gonna come down, and then you're gonna stay down. Okay, you don't want that. So you don't want to be losing weight during this period of time. That's very, very important.
Important. We have a patient question. She has surgery in 2 weeks. She says that she wasn't aware of these options. Is it something that you can discuss with her during the pre-op appointment?
Of course, yes. Certainly something that we can discuss. Really, between the BBL, skinny BBL, so BBL, all that, that's really, something that we can talk about in pre-op, and there's not really anything that you need to change. It doesn't really change your quote or anything else.
Thank you.
The one thing that is additional, though, is HD, right? So we're doing etching, we're doing, we're defining the muscles, doing abdominal etching and all that. Then of course that is an additional cost there. But all the other ones are, basically part of your package. It's really more about what you're a candidate for and what you're looking for.
Thank you. Real quick, do you accept wish picks?
I do. sometimes like to look at wish pics. That doesn't mean that I'm guaranteeing that you're going to end up like your wish pic, okay? Because sometimes wish pics are not realistic. But I do find that it helps me in the sense that I can get a sense of where I think the patient wants to end up, and also get a sense of what they believe they can achieve, which is not always what can actually be achieved, right? So if someone shows me a wish pic and it seems, fairly realistic, that's great, and we discuss that. If someone shows me a wish pic and it's like not realistic at all, then at least I know that they're having those thoughts, and I have to have a very, very serious discussion as to what is actually achievable. What is it from your point of view in terms of wish pics? Always try to choose one where the before photo looks very, very much like your before photo, okay? And it's not so much just about height and weight, because you can have certain height and weight, basically like two people that are BMI of 25 and their body shape be completely different. So just because she's BMI of 25 and she's BMI of 25, where they both have the same height and the same weight, does not mean at all that they're gonna have the same result, okay? Their frame can be different, their muscle mass can be different, the quality of the fat can be different, the quality of the skin can be different. Just the overall underlying foundation can be completely different.
During the lipo portion, let's say a patient wanted you to remove the buffalo hump, and
yes.
If so, where would that incision be?
Right, so we're doing buffalo hump, then we typically use the one that's here in that bra line area. It is tough to get from these ones out there, so we are going to do the buffalo hump, and then we probably wouldn't do the ones out here, and we do the one at the bra line, and then from there we can get to buffalo hump, we can get to bra line, and then mid-back, and then from here we get all that lower back area.
Thank you very much. I have a question about tummy tuck. My
Yes.
question is about the faja after the tummy tuck. At
Okay.
what point, meaning months, is the faja really not effective? I see some people wear it 2 months or even a year after.
Yeah. So for the tummy tuck, actually, the reason you see that is because it is quite variable. So when you start wearing the faja, once both drains are out, I do tummy tucks with drains. So typically the drains come out somewhere between week 1 or week 2. Once both drains are out, then you can switch to your faja type garment, and then you're going to use that for the remainder of the first 6 weeks, night and day, and then you're going to use it during the day between 6 weeks and 3 to 4 months, and then see where you're at. But that's the baseline. Nobody should wear less than that. Once you're at 3 to 4 months, some patients still have residual swelling, especially in that central lower trunk area, in that suprapubic area, and they do require to wear the faja for longer. And I have seen it, 6 months, 8 months, even up to a year.
Thank you. So after they wake up from surgery, when can your patients start with massages, and how many do you recommend?
So for BBL, you want to start as soon as the next day, okay? That's going to be your first massage, and the first 5 to 7 or so are going to be daily, okay? Every single day. After that, you can start spreading them out a bit. You can do about 2 or 3 a week till you get to about number 15. And then after that, you're probably going to do a weekly maintenance massage until you get to about number 20. For most patients, you're going to need a minimum of 20 to truly optimize your results. Okay? And I've been changing this throughout the years. I would say maybe a couple years ago, I was saying the minimum was 10. I found that, another 1,200 or so BBLs later, I found that 10 is not enough. So I think for most patients, you're going to need about 20. And if you're actually, you might think it's the opposite, but actually if you're skinny or HD, you probably need more massages, not less. You probably need 25 or so massages if you're skinny or HD. So typically skinny HD patients need more massages, not less.
And of course that helps with the results.
Yes.
Another thing post-op is working out good or bad immediately after, when you're able to after surgery, or does that hurt? Does that burn the fat?
So definitely not immediately, but working out is definitely helpful in the long run, okay? So I've done a few lives and where I discuss surgery versus exercise versus diet, okay? And you can always go to our YouTube channel and look it up and see the entire thing there. But the bottom line is that the best is the combination of all three. Surgery is not a substitute for exercise or vice versa, and none of them are a substitute for diet, okay? So we get it both ways, right? You have the people that, you always get that asinine comment, oh, she should have just worked out. That's a completely asinine comment. It's people that have no understanding about how fat works. They don't understand fat physiology or how to change the body's foundation. There are certain things that it's just physically impossible to work out. For example, hip dips. Hip dips, the official name for that is a trochanteric depression. That means that it's an area where there is no muscle and minimal fat. You can't build muscle there. It is physically impossible to work out a hip dip. It just cannot be done. The only way to round out a hip dip is to place fat there, and the only way to do that is with fat transfer, which is surgery. All right, long-winded answer to say that yes, all three are important. You get the best results when you combine all three, but you don't start working out until at least 6 weeks post-op. Then at 6 weeks, what I do recommend are workouts that are based on weight. Whether you're using actual weights or your own body weight, those are the best workouts. For the buttocks specifically, squats do really, really well, okay? And I do not recommend long cardio workouts, like marathoners, running long distances. That type of workout will then kind of shrink the fat in the areas where you don't want it to shrink.
Thank you. So how long does it take for your appetite to come back after surgery?
It can, it's going to vary between patients. Initially, you probably won't have very much of an appetite because of all the effects from anesthesia, plus all the medications and the antibiotics that we give you. And that's okay. Like in the first week, if you're not eating that much, if you're eating just simple things like soda crackers and chicken soup and things of that nature, that's fine. I mean, it's going to take about a week to at least a week to kind of get back, and kind of adjust to everything. But after that, then you should really start, thinking about your diet. Now remember, when your body is healing from a big surgery, and a BBL is a big surgery, okay, it tends to use more calories than it would normally, right? So you got to think about that and think about your diet and probably increasing those healthy fats even further into your diet and increasing your calorie intake a bit more simply to maintain your pre-op weight, okay? And that's why I say sometimes you do need to supplement a little bit with some milkshake, some ice cream, or if those are tough for you, you can get some of the Boost or Ensure, which you can get at the supermarket as well. But you have to do your very, very best to maintain that weight for at least 3 to 4 months.
Thank you. A few more exercise questions, and then I'll let you get out of here.
All right.
So specifically, exercise in the first 3 to 4 months, is that bad due to burning the fat? Or just, do you recommend just not working out in general and letting the fat really settle?
So at 6 weeks, you can start working out, and that's okay. And like I said, do weight-related workouts. So whether you're using the weights or you're using your own body weight, squats are great. And you can certainly start that at 6 weeks. At the very beginning, you probably want to take it easy, and then just kind of ease yourself up to it, for a couple weeks or so, and then start getting more into your routines. And then while you're doing that, be mindful how many calories you're burning, okay, and adjust your diet accordingly, because once again, you don't want to be losing fat, you don't want to be losing weight, okay?
So I already had a BBL to fill in my hip dips. I now work out lifting weights. Will this create hip dips?
So typically, no, if they've already been filled out, and of course you're like I said, you're maintaining your diet and everything else. What can make that fat shrink, like I said, are the long cardio type workouts. So that's why weights are good. But if you say all of a sudden you start getting into long distance running, for example, and you're running 5 miles a day, and then you're getting into like mini marathons and things of that nature, that type of workout does tend to shrink the fat in that trochanteric depression area, and then the hip dips can possibly come back. So you got to be very, very careful with that. So don't do long cardio workouts. If you want to do something for your heart rate, what works well is what we call high intensity interval training workouts or HIIT workouts.
Thank you very much. I know you have to get out of here soon. Really quick, how do you know how many rounds for BBL is too many rounds, where safety is starting to be a concern?
Yeah, that's a good question actually. We haven't had that one in a long time. It's a great question. So most surgeons, including myself, will probably not do more than 3 rounds. And that 3rd round is very, very much on a case-by-case basis. So obviously 1 round is fine. Round 2 is not, I would say, not uncommon. Not uncommon at all. I would probably say that probably about 25% of patients that have had a BBL will want to come back for a round 2 for one reason or another. Whether it's just because they want, more fat removed, or they want more fat transferred, or a more dramatic look, or they just want to fix, a few areas here and there. It's not uncommon to have a round 2. I would say, like I said, about 25%. But then round 3s are much less common, and those really have to be taken, with a grain of salt. Like, you really need to make sure you have a good evaluation of the patient, really understand their goals, because it does become more difficult. There's definitely a lot more scar tissue. The liposuction is very tough, can be very challenging sometimes. Okay, and you get less fat, right? It's the rule of diminishing marginal returns, right? Every time you go in, there's less fat that comes out because there's less fat left, and there's more scar tissue and inflammatory tissue, right? So we're saying the first round you got 4 liters, round 2 maybe you can get 3 liters, round 3 maybe you can get 1 or 1.5 liters, right? Rule of diminishing marginal returns. So round 3 is going to be taken on a case-by-case basis. I wouldn't do more. I wouldn't do more in the round 3 though. Then things become just the risk-benefit ratio is not there. The risk is too high. The benefit's really not there. Not worth doing.
Yes, safety first. All right, thank you very much. Thank you.
All right, everybody. Okay, well, I hope this kind of explains everything. I know we had a lot of questions about that since that article came out. So the different types here, we can, like I said, discuss all of these types at your pre-op. I'll be happy to go over all that with you then and create a plan that's very specific and unique to you, as all patients are, different. Okay. Well, I look forward to seeing everyone next Wednesday. But remember, all of these hump days are recorded and then they're placed on our YouTube channel. So you go to YouTube at Pure Plastic Surgery, and there's a whole bunch of information there. Pretty much almost any question you could have ever thought of regarding plastic surgery is answered on there. Okay? So I look forward to seeing everyone next week on Hump Day with Dr. Alex Earl.